We're going to look at the structures now that are found here in the infratemporal region or the infratemporal fossa. This is the part of the mandible that was mobilized. The coronoid process here, as you can see, it's broken. Remember, we have a gunshot wound, no, to the face of our cadaver here. So posterior to the coronoid process, we have the condylar process of the mandible, which is also part of it forms part of the neck and the mandibular head that will form part of the temporomandibular joint. So we're already missing structures here, no? The muscle fibers of the lateral pterygoid muscle. Lateral pterygoid muscle is an important muscle for chewing. It is involved in opening of the jaw, as well as protrusion or forward movement of the jaw, no? When we open our mouth. So there are two nerves here that are visible, and they are branches of the mandibular division of the trigeminal nerve. No? I hope you can see them. No? The area is quite dark, but let's try to get an angle where we can see them clearly, no? With enough light. I think this would be it. No? So that nerve at the tip of the forceps, that's actually the inferior alveolar nerve, or inferior alveolar branch of the mandibular division of trigeminal. It's also known as the inferior dental nerve. It will actually enter the mandibular foramen of the mandible, and it will innervate the teeth, no, that are socketed at the lower jaw or at the mandible. No? This other nerve right here, hope you can see, no? It's more anterior, no, and medial to the inferior alveolar nerve. That is another branch of the mandibular division of trigeminal. That's the lingual nerve. So it is responsible, no, for general sensation of the tongue, no? Sense of touch, temperature, pain. So general sensation, no? So the sense of taste is a special sense, no? And it is served by facial nerve, no? Actually, the lingual nerve, no, while it carries mainly nerve fibers coming from trigeminal mandibular division, it also will carry, no, nerve fibers coming from the chorda tympani, or the chorda tympani nerve. No, it also carries the chorda tympani nerve. No, chorda tympani is derived from the facial nerve, and the sensory function of the facial nerve is for the special sense of taste. So general sensation for the tongue, that is a function of trigeminal nerve. It's a mandibular division, while special sense of taste coming from the chemical receptors, the taste buds, that is the function of the facial nerve, no? Via the chorda tympani nerve that will be received by the facial nerve, no? Cranial nerve 7. Trigeminal nerve is cranial nerve 5. Mandibular nerve is the third division of the trigeminal, and we have the inferior alveolar or inferior dental nerve here as one of its branches, no? And then we have the lingual nerve, which mainly carries also sensory nerve fibers from mandibular division of trigeminal, as well as nerve fibers, no, of the chorda tympani. So deep to the nerves, no, not clearly visible, no, that's the medial pterygoid muscle, no. Just like the masseter, the medial pterygoid is also responsible for closure of the mouth, no. It pulls the jaw up, but it has additional function, no. Contraction of the muscle on this side alone, ipsilateral, it will swing the mandible to the opposite side. So this muscle right here, that's the boxinator muscle of the cheek, no? And let's review. This one is the Stenson's duct, no? Or the duct coming from the parotid gland. So if we're going to dissect this very well, no, there are also nerve fibers, no, coming from the mandibular division of the trigeminal that will pierce the boxinator. So that is not a motor nerve supply for the boxinator, because motor nerve supply to the boxinator is facial nerve, no? So the penetrating nerve, no, coming from mandibular division of trigeminal, that is actually for general sensation, no, of the buccal mucosa, no. Buccal mucosa is the lining mucosa, no, of your cheeks, no. So the mucosa of your cheeks, you can touch that, no, with your tongue, no, inside your mouth, no. So let's review them again, no. We have the inferior alveolar or inferior dental nerve right there. Then we have the lingual nerve, no. This one is the boxinator muscle. The torn muscle fibers that you can see, they are muscle fibers of the lateral pterygoid, no. Then we have the shattered or the broken coronoid process here of the mandible. Then the duct of Stenson, no? And you can also see you have dark colored vessels, no? Those veins, no, they belong to the pterygoid venous plexus, no. So it's a venous plexus, no, interconnected veins. They drain blood, no, coming from this area of the face. So there is now no one large vein that you can identify there, no?